Perfect. Well, welcome to FACE2Face, everyone, a series of virtual supports for CPS parents during the COVID-19 health crisis. So as our district continues to navigate through challenging times, we want our families and students to know we are here to support them. Phase 2 has launched a series of virtual workshops to help families build on their strengths. Offerings are from academics, mental health, arts and self-care, social emotional learning, technology assistance, and direct access to experts from the field. We're going to make sure to put our link in the chat for our mailing list. Please make sure to enter your information. So very quickly, this session will be recorded. We want to share this knowledge with parents who are unable to attend. If you wish for your image not to appear, please click on the video icon. Otherwise, your image will appear on screen when you speak. If you do not consent to be a part of the recording, you may end the video call now and wait until our session is available on our YouTube channel. That link will also be in the chat. If you stay, we will assume you consent to the recording and we will inform you when we have stopped recording. Please don't miss out on our future sessions. Like I mentioned, that link to register for our mailing list will be in the chat. I know tomorrow at noon, we have the Chat to Learn program in English and also our dorm room sessions where we'll be talking about LSC Office. If you have any questions, please make sure to reach out to title1@cps.edu or reach out to Norma Celadon, whose information will also be in the chat. Our wonderful presenter, Alexandra Sontang, is here with us today. She is the advanced nurse practitioner at CPS. And as soon as I am done sharing my screen here, I will pass the presentation on to her.
All right, so a little bit about me. My name's Ali Sontag. I'm a nurse practitioner at the Office of Student Health and Wellness here at Chicago Public Schools. I'm actually a Chicago Public School graduate, K through 12. And I'm a proud Chicagoan, so I love any opportunities to connect with our families and to support, all of us as we kind of navigate a new and challenging situation. So today, our topic is going to be health and safety protocols in schools. Some of the content here, the slides will have a lot of in-depth information. Some of the slides, I'll take the time to go in and explain them. Others will just kind of go through the high level explanation. And this is so that you have the information if you want it at a later time, but we wanted to make sure you had everything available to you. And that if you have specific questions, we do intend to leave some time at the end for those questions. So our mission here in the Office of Student Health and Wellness is to remove health-related barriers to learning and advance health equity here in Chicago. Our office believes that health equity is not just focused on our students, but on our families and our staff as well. Our office does a lot of different things. We do health promotion, such as recess and health education and sexual health education, and we do the gardens. We also do health information, where a lot of our student data around health is worked through, health services such as vision and hearing. We do Medicaid and SNAP enrollment through the Children and Family Benefits Unit. And our newest kind of additions to our family is the COVID response. Contact tracing and COVID supports come through our office, and as well as some of the nursing work is shared between our office and the Office of Diverse Learner Student Supports. So our presentations will kind of range in these topics. Today's topic is really focused on COVID, but you'll see kind of a variety of experts that we bring from the Office of Student Health and Wellness. In our office, everything we do is grounded in the idea of supporting the whole child. And that's our commitment to seeing our children, our students, as part of a larger complex world, both in school and then in the community that surrounds them. So the objective of this presentation is to address health and safety protocols around COVID-19 in our schools. And at the end of this presentation, we hope you'll be able to understand how COVID is transmitted, know how to protect yourself, and understand the health protocols at our schools. What is coronavirus? We've been in this pandemic for about a year, and we've learned a lot in the last year. So a coronavirus is a as a type of family of viruses, and COVID-19 is a specific type of that coronavirus family. And the family of viruses actually make up 10 to 30% of the common cold. And the control is difficult because it's transmitted through breathing, right? Through respiratory droplets. So that's called person-to-person transmission. And this means that COVID-19 is spread through contact with other people's respiratory droplets, such as when they cough, sneeze, laugh, sing, talk, right? It's that little droplets when you hold your hand up to your mouth as you speak. You can feel just a little bit of damp. Those are the droplets that we're looking to contain, that could contain the virus if someone is sick. And it is primarily spread through close contact with another person, which is defined as being less than 6 feet apart for 15 or more minutes. And it's with or without a mask, but mask helps prevent transmission. And we know that the highest risk for spreading COVID-19 is within a household, is among household contacts, and that exposures outside of the household are less common. They still do happen, and we're really looking to prevent that happening in our schools to the greatest extent possible. So we'll talk about the types of exposures, right? So on the far left, we have our person with COVID-19. And our first degree exposure is a person who had direct contact with the person who got sick. Those are the people, our first degree exposures, that we're looking to quarantine. And we quarantine them so that if they get sick, they don't get other people sick. So we're able to stop transmission through quarantining. Now, the people that they may have come in contact with are second degree exposures. We don't quarantine second degree exposures because those people didn't have direct contact with a person who was sick while they were contagious. And so the idea here is that the people we're looking to connect with for contact tracing purposes is the person who is sick, so we can figure out when they were, present and when they got sick. And then any people that they had close contact with, which would be those first degree exposures who would need to quarantine. So who can get sick from COVID? Anyone can get sick from COVID. And lots of people have either no symptoms or mild symptoms. And this is one of the reasons why masks are so important, because you could be transmitting COVID-19 and not know you have it. So that's really why we want to make sure everyone is wearing masks. We also know that younger, healthier people are less likely to have symptoms, and that older people who are over the age of 60 and people with underlying health conditions are at a higher risk for having serious illness, hospitalization, and even death, but they're not necessarily at higher risk for getting COVID, but they have more complications if they do get it. The good news is that 99% of people who get COVID do recover, and we're still studying the long-term effects, right? So that there is absolutely risk of serious illness, hospitalization, and death, but the vast majority of people do recover. Those who recover may have some long-term complications, and we're looking into the science to continue to support them. So the symptoms, 2 to 14 days after someone is exposed, so that close contact, our big three are fever, cough, and shortness of breath. But we know that there's actually a wider range of symptoms than we first thought. Specifically to COVID, we see a lot of people experience loss of taste and smell. If you experience any of these symptoms, especially if you have been exposed to COVID-19, we very much encourage you to get tested. Emergency warning signs, right? If someone is sick with COVID and they start experiencing any of these symptoms, such as trouble breathing, they can't get out their words, they have confusion, or they're super sleepy, we need to make sure that they're getting connected to medical care. So how do we create a safe and healthy environment to learn in? So there's a couple things we can do to stop the spread, some as individuals and some as a school community. As individuals, we need to do the 5. We need to wash our hands, not touch our face, cough into our elbows. We need to stay 6 feet apart. And if we're sick, it's very important we stay home. Now, as a school district, there are 6 things that we're focusing on doing. We're identifying, reporting, and isolating COVID cases as quickly as possible. When we're notified of a case, we're investigating it promptly. From that investigation, we're finding close contacts and quarantining people quickly. We're not making mass gatherings, so no large groups of people are getting together. We're screening people when they enter the building for symptoms or exposures, and we're wearing cloth face coverings while inside school property. CPS has done, a lot of work specifically around our buildings, as well as contact tracing, testing protocols. So we'll go through some of these in our questions. So some questions we've got are, will students be required to wear face coverings? Yes, students and staff, anyone inside our CPS building must wear a mask that covers both their nose and mouth to prevent the spread of COVID. We want to make sure that mask is worn correctly. You can see the image above, right? It's covered. We want them to be 3 layers. And we want to make sure that, we're washing our hands if we touch our masks to keep them as clean as possible. There are some exceptions for mask wearing. Children under the age of 2 years old should not have to wear a mask. Anyone who has trouble breathing in a mask, right, has a medical condition, and anyone who's unconscious or can't remove the mask for themselves. And OSHW has worked with ODLSS to create a protocol for families to apply for accommodation if their child falls into one of these categories that would need a mask exemption. So how will classrooms be grouped to avoid mixing? And this is the idea of a pod. So students and educators will be grouped into stable pods, which is, like half a class, give or take. And this is to minimize the exposures to other students, to create space for social distancing in a classroom, and then to make it easy to contact trace when we need to. So our pods are about 15 students. And then the teachers may go through multiple pods, right? So they'll have an A pod and a B pod in the hybrid model. So they'll end up seeing multiple pods, but the pods themselves stay the same from week to the greatest degree possible. And really this creates these smaller class sizes, create that space in the classroom that allow our students to socially distance. What steps will my student need to take before entering the building? So the biggest thing we want everyone to do is to fill out a daily health screener. We've created a process where you can get a daily text message to remind you. You do have to opt in for these texts. If you choose not to opt in, you can still fill out the health screener by going to cps.edu/health screener. And that'll take you to the screen. There is a language preference, so you can select your language. And then it'll ask you questions about student attendance and, any symptoms, recent travel, any exposures if they're waiting on a test. And then at the end, you'll get a green screen if you're good to go, and a red screen if you failed the screener and you need to keep your child home because they are unable to attend because they either have symptoms or they've traveled somewhere recently. That's not, that they need to quarantine when they return. So after passing a health screener, everyone who enters our building will get a temperature check. If your child has failed either the temperature check or the health screener or starts developing COVID-like symptoms during the day, you will be asked to take them home. And then alternately, if your child arrives without completing a screener, you will be called to ask to complete the screener when they arrive. So this just got updated. So recent travels outside of Illinois, we're updating this policy today. So we'll put an updated slide to share out with everyone. So if you travel inside the United States, you can either quarantine for 10 days when you get back, or if your child or a household member who they traveled with receives a negative test, they can exit quarantine before those 10 days are up. And we will update that slide shortly. So how does COVID testing and contact tracing work? So COVID testing is part of the district's initiative to support our schools, specifically focusing on the students in the zip codes with the highest rate of COVID in Chicago. And so testing will be offered at those schools in those zip codes about once a month to the students. You do have to sign consent to opt in. And the idea with testing is that many children and staff don't have symptoms of COVID. So the only way that we can, find out is to test people. So we're testing asymptomatic people. If you're experiencing symptoms of COVID, we very much encourage you to get tested as soon as possible outside of the school, because we want to make sure that our schools are healthy and safe places. Contact tracing, the district has hired a team of contact tracers that are specific to the district. Our intake tracers speak both English and Spanish. We have a mix, and they work to interview families and staff whenever someone reports that they have COVID-19 to figure out where they were while they were contagious. This allows us to do contact tracing to figure out who their close contacts were, but also allows us to clean and disinfect the areas they were in. How will I know if my student was identified as a close contact? So if there's a case of COVID-19 at your child's school, that person first self-reports to us at the district, cps.edu/COVID results. And then the contact tracing team will call to start the investigation. If the person was infectious while in the building and had close contacts, those close contacts are identified and they're given they're emailed that they need to stay home. This is for both staff and students. And then their information is provided to the Chicago Department of Public Health. And you will also receive a call to provide you with further instructions. What happens if my child gets sick while I was at school? Any child who arrives to school with COVID-19 symptoms or develops symptoms throughout the day will be sent to a care room inside the school. This allows for the student to be isolated from other students to prevent spread in case they do have COVID. The child will remain in the care room under supervision until their parent or guardian arrives. These care rooms are designed for easy cleaning, so they are disinfected regularly, and the staff who interact with your students will be wearing a high level of protection, a mask with an N95 level of protection. Are school staff getting vaccinated, and can my child get vaccinated? These are great questions. So school staff are considered essential frontline personnel and are eligible to receive the vaccine under 1B in Illinois. At this time, there are two vaccines. There are 3 vaccines on the market, but only Pfizer is approved for people over the age of 16. And so there aren't, right now, we're not vaccinating people with chronic conditions. That's the 1C group. Once we get to 1C, only children over the age of 16 and have a chronic condition could qualify in that category for vaccine. So there's not a lot of options available right now for children. That being said, if you do have a child who's over the age of 16, please reach out to their doctor to see if they can qualify for that vaccine group when it becomes available. Additionally, there are 3 trials that are looking to expand the ages of the vaccines. One trial goes down to 12. The other one goes down to 9. We should be receiving results from those trials in the next month or so. And hopefully we'll be able to provide children vaccine soon, but not immediately. Is there a way to see how many COVID cases are occurring across the district? Yes, the district is working very hard to be transparent in these matters. And so we're posting any completed contact tracing on our public website, cps.edu/school reopening 2020. And you can click there. It shows you both the district's trend and then individual school cases. All cases are talked about in a de-identified way. We never share information beyond the people who need it to do the work. And that's one of the reasons we've made contact tracing centrally. So that way, the school principal, if someone tells their principal tells them to tell us. We do the investigation. Any information that's shared is shared without any names. So it's as private as we can make it. And we think this is very important for a variety of reasons. We recognize that there is stigma around COVID, and we want to make sure that we're protecting both our students and our staff from experiencing any harm as a result of these communications. So you'll receive communications. It'll say a person in your building or a staff member or someone in your pod. It's going to never name the person. It'll always be general. What steps are being taken to clean and disinfect the buildings? We've bought hospital grade disinfectant sprayers, and we've created new protocols, and we're hiring an additional 400 custodians. So definitely working on keeping our buildings clean and disinfecting whenever we have COVID cases. Proper clean air and ventilation in our buildings. We've invested 8.5 million into HEPA filters, but then also you can find, they've done ventilation studies, and those are also available at cps.edu/air quality. So when should I get tested? These are the most important times to get tested for COVID. If you're having symptoms of COVID-19, fever, chills, cough, difficulty breathing, sore throat, body aches, new loss of taste or smell, congestion and running nose, nausea, vomiting, or diarrhea. If you have new symptoms that are one of these COVID symptoms, you should get tested. You should also get tested if you've been in contact with someone who's ill, especially if it's someone that you live with. So if someone has COVID and you've been exposed, you should get tested between day 5 and day 9 after your last exposure to them. If you've been in a high-risk group setting, like a large gathering or a crowded space, when we do studies, these are the places where COVID is transmitted in large group gatherings. There was an indoor gym class they had a lot of people in a small space. And so they ended up having several COVID cases. So if you're at a recent event, that's a good time to get tested too. And then if you've recently traveled to a high risk area, we encourage you to get tested. And then those are kind of it for our large questions we got ahead of time. Do you have any questions for me?
Perfect. Thank you, Ali. Very quickly, in the bottom of your screen, everyone, you will be able to see the Q&A button. Please make sure to click it and ask any questions that you may have. For now, I do have a question that a parent submitted. So I'm going to say very quickly in Spanish because it was given in Spanish, and then I will translate it. So it's, las escuelas contratarán con más fondos para que lleven a cabo los protocolos de salud recomendados, más personal de apoyo, suministros. So will schools, will they have more funds to carry out all recommended health protocols, more staff, supplies, etc.?
Absolutely, that's a great question. So kind of recognizing that school budgets are fixed and didn't really account for a lot of this COVID related spending. Most of the district's spending has been centrally. So contact tracing, the district has funded from the central office, hiring new custodians, that's been funded through the central office. Also things like cloth face coverings, hand sanitizer, disinfectant, even, PPE, personal protective equipment for our related service providers or our nurses. All of those have come from the central office through the district, and we're not asking individual schools to purchase them. So yes, there's additional funding because the district has taken on those obligations centrally.
Perfect. Thank you, Ali. So I'm not seeing any questions as of now. I know if anyone would like to take this time to take advantage that we have Ali here with us to give us this information. If you guys have any questions, once again, please put them in the question and answer. Perfect. We have some popping up now. So we haven't had in-person school since September. Mm, Uh, Roberta, if you would please like to finish the question. I think it cut off too quickly. So here's another one. How have you decided to deal with financial difficulties of the family suffering with COVID-19?
So the district recognizes that there's COVID and not impacts all of us in a wide range of ways. And so we are trying to work with the city to leverage city resources um, to connect our families when they have those kinds of needs. We're working to, so if you do have kind of concerns, we'll do our very best to connect you with what the resources that we do have. 773-553 kids is a great resource. There are healthy CPS hotline, but they also are working to kind of connect families. There are things that we do internally in the district, like Medicaid enrollment and SNAP benefits, that we encourage all of our families, if they have those needs, that's something we can do directly. But we recognize that needs are sometimes beyond that, and really trying to connect them with local community resources that will help them what they need.
Perfect. And a little more about money here that for funds for schools. Will money that wasn't spent for in-person expenses be diverted to cover COVID PPE, etc.?
So there actually haven't been a lot of in like I don't have the numbers, but we're still paying all of our teaching staff, even though they're working remotely. So a lot of those expenses are not unchanged, right? We're still providing meals, we're still paying for teachers and custodians to clean. And so while our students haven't been in our buildings consistently, we still have a lot of expenses that we're paying in other ways. The COVID expenses for PPE, that's all coming from the district. And so schools are really being asked to, continue to fund what their school needs. And so that the district is trying to provide the coverage for those COVID related expenses.
Perfect. Thank you, Ali. We still have some time for some more questions. If people would like to put their questions in the Q&A section at the bottom of your screen. Perfect. So here is a question more about kind of what to do if COVID is contaminated. So families going through the after effects of COVID-19, what can they eat or drink?
Sure. So if someone's experienced COVID-19, a common symptom is the loss of taste and smell. This doesn't mean that they can't eat or drink anything. It just means that things don't taste very good. And so there aren't any restrictions on foods that you can eat or drink, but oftentimes people don't get pleasure from eating, right? I had a person I was talking to who said they couldn't taste water anymore. And I had to think about it because I don't think I remember tasting water, but it would be strange if it tasted like nothing. So that's a common thing that people experience, is that they're no longer able to taste things. So no restrictions in what you can eat after you have COVID. The best advice that we give to people when they're, have lost their taste and smell, and that symptom particularly, that can last up to months after someone has had COVID. It does not mean that they are contagious or can get other people sick. It's just one of those symptoms that lingers. Our recommendation that I've given to people that I've worked with who are experiencing that symptom is try to find things that you do like to eat. I know people were big fans of like popsicles or things that were hot or cold. If they couldn't taste things, sometimes it was textures that they were like, well, I really did like the texture of pudding. Not for me, but this person did.
Perfect, Ali. Thank you. So what are thoughts on traveling for spring break?
Absolutely. So travel is a complicated question, right? Um, I know that we've all been cooped up for a year and we're ready to not be in our homes and not be in Chicago, probably. I recognize that. So travel increases risk. We know the risk in our homes and in our communities. And so when we travel beyond them, it is a different set of risks. And also, we're bringing in things into that community. So you'll see kind of around the country a lot of, even here in the US, like Washington, D.C., for example, has similar travel rules to us where if we're going to visit them, you need to have a negative test 72 hours before you arrive. This way, they're pretty confident that you are well when you get there. Um, Generally, travel is, you want to limit it to the greatest degree possible. And if you do choose to travel, you want to make sure that you're doing it as safely as possible. Follow the local recommendations around testing, make sure that you're socially distanced and wearing a mask to prevent that spread. And then when you come back to Chicago, anyone who returns from domestic travel has to follow the Chicago Department of Public Health's rules. And they have a specific list of states, some that are yellow states and some that are orange states. Yellow states have a lower incidence of COVID, similar to us here in Illinois, while orange states have a higher incidence of COVID. And if you return from an orange state, you need to receive a negative test when you come back, and or you need to quarantine for 10 days. And that's from the Chicago Department of Health. So if you're going to travel, make sure that you're, reading both our rules here when you come back and the rules of the place that you are going. And anytime you travel, you just want to be very cautious. Now, international travel is a little different. International travel, we follow the CDC's rules, and their rules are that you have to quarantine for 10 days, or if you receive a negative test, that you quarantine for 7 days and have a negative test. And similarly, when you're traveling in the US, if you choose to travel abroad, you need to make sure that you're following all local health requirements as well. So if you can avoid travel, please do, but recognizing that it is complicated, that there's both local and national guidelines that we need to follow.
Perfect. Thank you, Ali. That was great information. A parent is asking if you can speak about any plans for high school students and the return to in-person class.
Absolutely. So my spouse is a high school teacher, so no one wants to get back to high school more than my family. No, I think everyone with a high school student or a high school staff member is kind of looking for this information, and we recognize that. We're working closely with our union partners to figure out what high school return looks like. That conversation is ongoing. I think it's even happening today and this week. So it's an ongoing conversation, and when we have an update, we will provide it to you. I know many people are very anxious to know kind of what that looks like for our high school students.
Great. Thank you, Ali. Once again, this question is coming in Spanish. I will translate to English as soon as I finish. So, ¿y cómo es el proceso cuando están recibiendo los alimentos los estudiantes en el edificio? So, kind of what is the process when students are receiving their lunch in school?
Yeah, absolutely. So it depends on the school. We're really trying to partner as a district with individual schools to make sure it works for them. Um, there's a couple different options that you might see at your school. One very common option that we're encouraging schools to follow is classroom meals, where the meals are brought to the classroom, eaten in the classroom, and then disposed of. This keeps the pod together, and tries to contain students so they're not passing in hallways, mixing, those kinds of things. That's one option. Another option, depending on your school size and their schedule, would be to use lunchroom. When that happens, right, it's one classroom or one pod at a time. Pods can use the lunchrooms if they're separated by 50 feet. So if you have a very, very big lunchroom, right, you may be able to have one pod on one side and one pod all the way on the other. If you have a very small lunchroom, it may only fit one pod at a time. So you are allowed to use the lunchrooms as long as all the pods are together. And if there's multiple pods, they're very far apart. Those are kind of two lunch options that we're seeing. Similarly, many students already have breakfast in the classroom as part of our regular school day. So many schools have chosen that first option of classroom meals instead.
Great, Ellie, thank you. So the next question is, no tengo muy claro si los estudiantes tendrán que hacerse la prueba del COVID-19 todo el tiempo. ¿Qué es la escuela cuando la escuela lo requiera o solo si presentan síntomas? So the question is, I'm not too clear if students are supposed to be testing for COVID-19 all the time or when the school requires it, or only if they present symptoms.
It's really if they present symptoms. That's the big one. If your child is experiencing symptoms of COVID, please get them tested. That's a great question, right? That's when we know people are the most contagious, is when they're having symptoms. So that's the one that's my number one time to test. We may be doing student testing in those zip codes as additional support. As long as your child is well, you haven't, you filled out the health screener and passed, I don't need your child to test, right? There's a couple other times where we might want you to get tested, right? So experiencing symptoms, number one, stay home, get tested, wait till you have a result. If it's negative, come back to school. Number two is if you're deemed a close contact. So we want you to quarantine. If you've been asked to quarantine, we're going to ask you to stay home for 14 days. And then between day 5 and day 9 to go get tested. So this isn't, you won't be able to leave quarantine early in this case. You still have to finish the 14 days, but we want to make sure that you're getting tested in case that you're quarantined. So that's the second reason to get tested. The third reason to get tested is this travel, right, that we just talked about. If you've recently traveled, we want to make sure that you're negative upon your return and following those protocols. So CDPH has protocols for domestic travel, and then CDC has protocols for international travel.
Perfect. Allie, now that you mentioned the health screener, do you mind kind of going over what it looks like, kind of the importance of doing the health screener every day?
Yeah, absolutely. So the health screener is kind of a way, and I even catch myself doing it. It's a way to check in on how you're doing and if it's really a good idea for you to be present in a building that day. So I know a lot of, most of us just go to school and go to work, right? We're kind of on autopilot. The health screener asks us to stop and think. It asks us to really think if we or our child is experiencing symptoms, right? Me, in the case that I'm an employee filling it out, but if I had a child, that make sure my child is well. So the health screener asks us to stop and answer about 5 questions. Are we experiencing symptoms? Have we recently traveled? Have we been exposed to COVID? And are you waiting on a test? If you're waiting on a test result because you think you might have had it or been exposed, you need to stay home until you get the result of that test. And so that's how the health screener functions. It also allows us let's say you're visiting a building, you're a parent, right? It also allows me to have your information in case we need to contact trace if there was a close contact that we needed to quarantine you for. So it allows us to do both at the same time. Sometimes people forget, right, that they aren't feeling well until we've had people walk up to the door, fill out the health screener, realize that they have a terrible headache, go home, and later test positive for COVID. The only reason they didn't come in our building that day is because they stop to fill out the screener. And it's that keeps people as safe as possible, because you've prevented people from transmission. If you're not in our buildings, you can't spread it to someone else. And that's the hope with the health screener.
Perfect. And now someone's asking in regards to the health screener, where do they get the health screener? I mean, is it just at the door?
So we have our health screener online. So you can fill it out on the day of before you even come in, cps.edu/health screener. And once you get there, you can select a language. For your student, you can log in with either their CPS email and their ID number and their birthday. And that'll just pull up their information. You just fill it out, answer those 5 questions. You'll get your green screen if you're good to go, or you'll get a red screen that tells you to stay home. So it's very easy. You can also sign up as a parent for text messages, where we'll text you a link to the health screener every day, and you just need to click on the link and it'll pull you right into the screener. And it's a pretty easy process. There's a lot more kids in our buildings today than there were yesterday, which is exciting news. And we recognize that, sometimes technology just doesn't work. Sometimes my phone might be dead. We know that happens. And so most schools have a way to do the health screener at the front door. They'll have computers. They'll have someone to ask the questions and fill it out for you. They might even have paper forms in case, let's say, the internet goes out. So we've tried to create a lot of options for you to get this done easily. Honestly, the quickest way is to do it right when you get up every morning. It's what I do when I go into a building. The first thing I do is, I'm putting my shoes on and I log into the health screener before I even leave the house. If you're going, so let's say your student has to be at multiple schools, or you have to be at multiple schools, right? You have a high school student and an elementary school student, and you have to go to both schools that day for some reason. You can select multiple schools when they say, where are you going? And that way you only have to submit the screener once, and it'll fill for all of the schools that you plan to attend that day.
Perfect. Thank you. Now that we're talking about, just protocols and all this good stuff, how can parents talk to students about the importance of social distancing and kind of making sure that they abide by that?
Yeah, so social distancing is really hard for adults, right? Like, we want to run up and hug people and say hi. Children are actually surprisingly more adaptable than kids or than adults if you give them the opportunity and kind of explain the reasoning. So one thing that we found is by creating new greeting rituals, right? Normally we run up and we hug people, right? Make it, an air high five, bump elbows instead of shaking hands, have different ways to engage that make people feel connected, even though they're far apart. Another thing to do, especially for kids who don't have an idea of how far apart things are, I've seen teachers use noodles, like the pool noodles you get, which are, probably about 6 feet apart, to see how far 6 feet is. And it's a lot further than we think. Now, in a classroom, we don't expect our children to stay 6 feet apart at all times, especially our littles. They want to play, right? And it's about playing and, learning in that way, which is also why they're a pod, right? When we're seated, we'll keep people 6 feet apart. But there will be times, especially with our smallest kids, that they'll interact, that they'll be in less than 6 feet apart playing. That's okay, right? We want to teach what 6 feet apart is, keep them at that distance, whenever possible, but recognizing that they kind of will come together and then separate out. And that's okay. That's one of the reasons that they're a pod, so that if someone did test positive, the entire pod goes to quarantine, right? Instead of what we do with adults is we interview, we figure out exactly who's 6 feet apart, how long they were. We can assume that at some point, everyone in that pod was in less than 6 feet apart, right? So it takes practice. There's some fun ways to engage families and teachers and students in those conversations. but also recognizing that the people you want to be 6 feet apart from consistently are when you're mixing pods, right? Um, when I'm at the grocery store, when I'm in public and I don't know the people around me, I want to make sure that I have lots of distance between myself and that my mask is on. Just kind of recognizing that does kind of ebb and flow.
Great, Allie, thank you. So another question coming in is, how do I know if another child in my child's class has a mask exemption?
Yeah, so that's a really great question, and it's a complicated one, just to be honest. Um, Student information is protected by something called FERPA, and FERPA is a set of federal laws that mandate how a district is allowed to communicate about student information. Some student information is private and can only be shared with the permission of their parents. So we're trying to balance sharing that student who has an exemption, that information, with kind of the larger school. And so we're working with principals to create a way to communicate that in a safe and healthy way that protects that student and their, identifiable health information, but also provides families with the information they need. But that's a really challenging question, and we continue to work with our principals to problem solve for that one.
Great, thank you, Allie. Next question is, are teachers mandated to get the vaccine before going into school?
So this is, once again, this person has lovely complicated questions, and I'm happy to answer them. So mandated vaccines are allowable, right? Except right now. So both the Moderna, the Pfizer, and now the Johnson and Johnson have received something from the FDA called an emergency use authorization, an EUA. This EUA has to go through all of the same scientific rigor as the normal process, but it is expedited. It's quicker. Until it is no longer under EUA, none of those vaccines can be made mandatory. So, yes, vaccines can be mandated for employees. No, not right now. They cannot be for COVID specifically. And that's just where we are. And that's true for us here in Chicago and elsewhere. We can encourage people to get vaccinated, right? I've gotten vaccinated. If you have questions about that, I'm happy to answer about my experience with the vaccine. But we can't mandate it at this point.
Allie, that's actually a very good idea for people who are able to get the vaccine. And can you share your experience with us on that?
Yeah, absolutely. So I'm a nurse. So I was part of the 1A group here in Illinois. So I got vaccinated pretty early on. I received the Pfizer vaccine through the Chicago Department of Public Health. I got my first dose back in February, or no, January, and I didn't have any symptoms. My first dose, I felt fine. My arm was a little sore, nothing out of the ordinary. For me, my second dose, I had more symptoms, right? I felt tired. I had the chills. It lasted maybe 12 hours, and I woke up the next morning and I felt a lot better. So sometimes people will experience symptoms. My spouse, who is a teacher, is part of the 1B group. He recently got his second dose and he had a sore arm and took a nap in the afternoon. So he had very little symptoms. I had some more symptoms with my second dose. Each person's experience is very different. Experiencing symptoms or not experiencing symptoms, neither of them are bad. Neither of them are good. It's just how your body responds to the vaccine. In both of our cases, right? He's now 2 weeks out from the vaccine, and I'm 4 weeks out from the second vaccine. So we're considered fully immunized. Our bodies have made the antibodies that will help fight off COVID if we were exposed to it. Even though he had very little symptoms and I had a lot, the data is showing that our immune response is similar and we've both created antibodies to help protect ourselves.
Thank you, Ali, for that information. Can we just kind of go over how to get students ready to go back to in-person school?
Yeah, absolutely. So transitions, so my background is a family nurse practitioner, so I think about everyone, the whole age span, except women who are giving birth. That's not my jam. But whenever we're thinking about children hitting transition points, we want to help them prepare by creating routine. Um, so whether that is they're picking out their clothes the night before and they pick a mask out that matches, right? We need to incorporate this new world we live in into their old routines to the best degree possible, right? So giving children choice is really good. You need to wear a mask. Which mask do you want to wear today, right? There's no wrong answers. Letting children, if they're gonna, have to wash their hands, right? Have them pick out the soap they want to use, right? Some things that are really common in pediatrics right now is dry hands with all the hand sanitizer and hand washing. In the winter, our little kids may get really kind of dry and irritated hands. So we do want to make sure that we're using lotions to kind of help treat them just like we would with our hands. Most of the time with little kids, we don't think about applying lotion because their hands don't normally get as dry as mine. But it's really common in the winter, and especially with all the hand washing we're doing, that if you do notice that your child has like dry or irritated skin, that you treat it like you would your own skin using, a lotion, something without perfume. And then if it's not getting better, make sure you're reaching out to your doctor to talk through some options. But that's something that we're seeing that's kind of a new thing with COVID, just because of the amount of hand washing we're doing. Other things is teaching children about their bodies, right? And able to tell us how they're feeling. And that's really hard and it takes practice. So, does your tummy hurt, right? Putting it in terms that they understand. If they're having pain, asking them to point where it is. When your child's experiencing symptoms of COVID, right? It's hard to figure that out. They're little kids. Sometimes they're very willing to tell us what's going on with them, and sometimes they don't want to or don't have the words. So working with your children to kind of figure out how they communicate with you when they're not feeling well. Also recognizing that some kids don't communicate when they shut down when they don't feel well, right? They curl up in a ball or they sleep a lot, right? So recognizing that sometimes signs of illness aren't necessarily what's on that list, and that your child, best. And recognizing that you're their expert because they're your kid, and you know them better than anybody.
Great, Ali. Thank you for that advice. We're going down on our last 5 minutes. Um, so if anyone has any additional questions, if you guys can quickly put them in the chat so Ali can answer them for us. Okay, let's see. Yeah, so kind of the question is asking in regards to emotional disturbances, kind of students who are still in remote learning, being socially away from their friends, and then now they're returned to class, kind of how to avoid, I guess, that outburst in emotion. I know you talked about how students kind of want to hug, they want to, hold each other after so long. Kind of how can parents, kind of bring that discussion up of, I know you've been away from your friends for so long, but there's kind of some limits right now.
Yeah, so creating those new routines is really important, right? Whether that is having honest conversations, I think is the starting point. Oftentimes we think that our children, oh, they're young or they don't get it. And if we don't take the time to explain it to them, they'll never get it. And so I really do think that there is value in having honest conversations about what's happening, but also your own feelings about it, right? Like I miss my friends too. And I haven't seen my friends in a really long time. And I just want to give my mom a hug, right? And my mom's not vaccinated yet. And she, she's on the older side and I need to keep her safe. But that makes me sad, right? And I know it makes my mom sad. So I think the first step in having those conversations is validating some of the things that they're experiencing. And it's often easiest to do that by sharing your own personal experience. It's not something every family does as part of their regular conversations. I know my household didn't growing up, but I think that there's a lot of value right now in sharing that experience with our children and then talking about things that you do and then modeling behavior, right? So like when I go over to drop off groceries at my mom's house, I always wear a mask the whole time. That way I'm consistent, right? Also not asking our children to do things that we're not willing to do ourselves, right? Our kids are watching us all the time and we're one of their first teachers as their family members. And so we really want to make sure that we're modeling the behavior we expect from them. So if we're socially, at the grocery store, I'm going to wait over here. There's a lot of people over there. I'm going to wait over here so that we're 6 feet apart, right? Explaining why we're doing some of the behavior changes so that they can kind of start internalizing those. But also recognizing that children will be children, right? And taking the time to explain and not necessarily penalize for these really hard behaviors. Um, when they when they don't do something, take the time to explain to them why it's important, right? This is to protect ourselves, or I'm wearing a mask at my mom's house to protect her in case that I'm sick. I think there is value in those honest conversations. There's some really great resources from CDC about having these conversations with your children that will include, we have a resource guide that we're going to update, and they're both in English and Spanish, and there's some good practices. People have also written some kids books about COVID that have been published. I even think someone from CPS wrote a book. So, also finding a book might be another way to broach those conversations if it's not something that you're necessarily comfortable with. But sharing and reading a book together might be able to have you start those conversations.
Perfect, Allie. Thank you so much. I know a lot of parents really appreciate you taking the time to answer these questions for everyone. We have reached the end of our presentation for today. It is now 5 o'clock. Very quickly to everyone with us here today, I want to thank you all for being here and asking all of these amazing questions. I know that we all have, but may not think of at the moment. I am going to put 2 links in the chat. They are just a quick questionnaire about today's presentation. Please make sure to fill that out for us. I will put the English link. Hello, everyone. Quickly, I want to end it. I think I was on mute. Very, very quickly. Thank you, Ellie, for giving us all that amazing information. To all the people here with us today, thank you so much for being here. We appreciate you guys asking all these questions that we all may have, but maybe not pop up at the moment. I'm going to post 2 links in the chat. One is the form in English for a quick questionnaire in regards to today's presentation. And then I will post the Spanish one as well. And thank you once again. That is the end of today's presentation.